Hello, my name's Katie Mauser. I'm an MSN F&P student, and this is my presentation on vaccine hesitancy. To start, what is vaccine hesitancy? When an individual is not fully committed to the idea of vaccination, this is considered vaccine hesitant. This can include vaccine refusal, but they are not the same thing. Hesitancy may still accept some or all vaccinations, but require additional education, conversation, etc. We reviewed a couple resources for this presentation, including O'Leary and Kemp, who described the overview of and impacts on hesitancy, gave consequences of refusal, safety of vaccines, communication techniques, and discussed ethical refusal management. An AAP source that gave tips for communicating with hesitant parents, reassurance techniques, and discussed the responsibility of the PCP in promoting vaccination. Immunize.org, which gave common causes for concern or questions in vaccine hesitant individuals and gave unprotected people stories. And a CDC site that was sort of a hub for vaccine resources. This included the vaccination schedule, recommendations and tips, pregnancy and travel specific recommendations, and provider-oriented materials. The purpose for this presentation primarily is to provide common reasons for vaccine hesitancy, give effective strategies to address hesitancy, and describe the pediatric provider's role in supporting vaccine safety. Additionally, the video will provide a case study demonstration on communicating with a vaccine hesitant parent. And finally, I'll reflect on what I've learned through creating the PowerPoint as well as through the case demonstration. To start, what are some common reasons for vaccine hesitancy? Some may feel that they prefer natural methods of immunity, such as natural infection rather than the immunization. There can be a fear that multiple immunizations will overload the immune system. Some have been warned of various consequences like autism, neurological disorders, or allergies resulting from immunization. Others believe vaccines weaken the immune system. There is a fear of limited vaccine testing, and at times people believe that vaccines can be delayed, spread out, and skipped without consequences. When addressing vaccine concerns, if a patient presents with one of these specific issues, the individual issue should be addressed. Here are some more general communication and trust building tips for vaccine hesitancy, which can be applied to all of the topics on the previous slide. First of all, listen to the patient. Also, use shared decision making. You can present vaccines as software updates to the parent. Address disinformation. Where does it come from? Who benefits from it? That sort of thing. Address the unknowns of vaccines. However, be sure to educate the parent that so much is known and it is all in support of continued vaccine use. Address both the individual and community benefits of vaccination. So that's discussing herd immunity. Explain clinical trials and the processes that vaccinations have to go through before they are actually used with patients. Describe how vaccines equip the immune system, they don't weaken it, and use the truth sandwich approach. Some important things to remember is that pediatric providers are trusted. Most parents do vaccinate, but they have questions and they need guidance from their trusted provider. Speaking of the provider's role, a very important part of this is presumptive language. There is a substantial increase in vaccine acceptance when presumptive language is used. This means don't go and ask, do you want this vaccine today? Tell them, today your child is due for this vaccine. We're going to get into the case study next. This is going to be a 12-year-old female. She's here for a well child check and sports physical and is also due for her HPV vaccination. Dad is with her in clinic, and that's who we'll be talking with, and we'll see that he has some questions and concerns about the vaccine that I, as the provider, will have to answer. Hi, Mr. Mauser. Hi, Addie. How are we doing today?
Good.
Just here for the 12-year well child check. Any concerns today?
Correct. Nothing going on for her today. Just needs a checkup for her school sports.
Okay, we can get a sports physical done. And then I'll also just do the general annual assessment for us today. And Addie is also due for the first round of her HPV vaccination, so we'll get that done today as well.
HPV, isn't that a sexually transmitted thing? I'm not sure she needs that this young.
I understand where you're coming from. And you're right, HPV can be a sexually transmitted disease. Some people are concerned giving the vaccine at 11 or 12 is too young. However, if the first dose of the vaccine is given before the age of 15, only 2 doses are necessary. After this, 3 doses are required. Past 26, the vaccine is typically not recommended because exposure has already happened.
Do you think this encourages earlier sexual activity, though?
This is also a common concern. We recommend the vaccine at 11 or 12 to reduce the number of shots rather than permit earlier sexual activity. It's also been shown to last for many years after vaccination, so it'll prevent infection into late 20s and 30s even.
Okay. I'm also a bit worried about the safety of the vaccine. We got all of her childhood shots, but this one seems newer, and I've heard there's less research.
Understandable, it is newer than some of the other childhood vaccines. However, the HPV vaccine has been studied for more than 15 years at this point and proven to be very safe and effective during this time.
That does make sense. Does she really need 2 shots of it, or could we just do one at 13 or 14 so that she isn't getting as much of an immune system overload?
I see where you're coming from. The thing with vaccines, though, is that they're weakened versions of the actual disease. Sometimes the body needs more than one reminder of what the virus looks like to fully create immunity against it. That's why we do a couple shots.
What is this protecting from? Warts?
Genital warts are certainly one of the things this vaccine protects from. However, perhaps even more importantly, it's one of only 2 vaccines that can prevent cancers as well.
Sorry for all the questions. I just get nervous making the decisions when my wife doesn't come to the appointments.
Don't apologize. You want to make the best choices for you and your daughter, and I respect and admire that. I want you and Addie here to be comfortable with your decisions. I just want to make it clear as your pediatric provider that I support these vaccines entirely.
I appreciate you taking the time to talk through this with me. Would it be possible to hold off for today and I'll talk to my wife first?
Of course. I also have some handout materials I can send with you to share with her. And I'll have one of my nurses follow up with you in around a week. If you have any more questions or ready to vaccinate at that time, we can set up a nurse appointment.
Okay.
Okay, so watching that case study, we see Dad's concerns are early use of the vaccine encouraging early sexual activity, the vaccine safety and testing, the number of shots received, and the purpose of the vaccine. My response as the provider is heavily education focused. I talk about the reason for the timing of the vaccine, the safety of the vaccine, the purpose of multiple vaccinations, and the cancer prevention benefits of the HPV vaccine. While Dad still decides to delay the vaccine, there's a set plan for scheduled follow-up, continued education, and I respect his decision while still continuing to strongly support vaccines. In summary, reflecting on this assignment, there are many resources available online for vaccine hesitancy. However, these are only useful if I take the time to familiarize myself with them. To be a confident provider, I must be well educated on what it is I support. Some strategies for clinical practice would be to have educational materials available for vaccine hesitant parents in clinic and to take home. Also, remember that parents who are vaccine hesitant just want what's best for their child. A personal takeaway I have is that as an FNP, I'm an expert. I need to honor that responsibility and the patient's trust by being well educated on what I am recommending. Thanks.